their malpractice insurance is so high is because
Right.
the third leading cause of death in this country is medical malpractice and medical error. Most people don't even know that.
What's up, truth seekers? You're listening to Damaged to Dangerous, where I bring my passion for pulling back the veil on a quote, pill for every pain, calling out what's broken in the medical industry, and exposing the lies about our food system. Let's walk in real healing to help those misdiagnosed, over medicated, and spiritually stuck get their lives back, body, mind, and spirit. Food is medicine. You're not broken. You've just been lied to. It's time to wake up, get free, and become dangerously whole. So let's go. Hello, everybody. We are so glad you're here for another episode where, we are trying to learn the tools and the teachings to take us from damaged to dangerous to the kingdom of darkness. So I'm grateful to have with me today Dr. Scott Oatsvall. He's located here in the Franklin, Tennessee area. I've been to his clinic. I loved it. Love more of it. And I'm grateful to have you on here and love to share with you because we're like-minded. And I think that's because we're trying to break through the big pharma and wonder, like one of the questions that I get a lot actually is why doesn't insurance cover for some of this more holistic naturopathic type healing when it doesn't seem to have side effects? And I don't know. Help me get free of bipolar. It's just that seemed to work when 20 years of psychotropic drugs and the bus hospitals and pharmacists and et cetera in the nation, it was an epic fail to me. And the gun next to my bed was proof of that. Does that make sense? I mean, there's hope, is what I want to come out of this conversation. And
Amen.
it's not in the next hospital or the next physician, it's in the great physician and the ways he's given us to live. So, welcome to the show. And let's chat about why isn't this accepted?
Thanks, Lynn. It's always a privilege and a pleasure to talk with you and be with you. I love what you're doing right here on the show and the podcast and building an infrastructure of listening audience up that wants to be educated and they want to know that there's better options and they don't want to just take a pill for every ill and get an ill for every pill. They want something that's different. They want something that's more vital to their lives to give them more vitality. And so again, I'm grateful to be on the mission with you, and I'm thankful that you invited me back to the show today. And I think, again, the question you ask is a very, very important question because most people, in fact, a lot of our patients and a lot of our clients always ask, why isn't this covered by insurance if it's helping so many people? And so we see so many results out of our clinic, whether it be the really, really difficult challenges, things like Parkinson's and ALS and cancer and autism and so many chronic illnesses and diseases, all the way up to professional athletes that are looking for better performance and longevity and anti-inflammatory, and people that are wanting better skin, better hair, sleeping better, waking up more rested. It really doesn't matter because when you think about the way the healthcare system is built, it's really not about whether it works or not. It's about how the insurance system bills for these services. So when you think about an insurance system, Lynn, you're thinking about a standardization and a corporation and a corporate structure and basically a financial structure that is built on whether they have these strict codes in place and all these categories that can fit under those codes. So for something to be covered by insurance, it has to fit into these specific billing codes. So when you think you're that, and these companies, they follow widely accepted medical guidelines, but at the same time, that same treatment has to be for large groups of people. So that's why you never get any customized care. And holistic care, it doesn't work like that. It's very personalized, it's layered, it's tailored to meet your individual need. And the diagnostics that we use is much more time consuming and labor consuming because when I sit in front of a patient for the first time, I'm expecting to be in front of them at least 45 minutes to an hour. because
Not 7 minutes.
I want to be a body detective. I want to make sure that we're covering everything and anything that they're concerned about, and then not just look at symptoms, but let's try to get to the core root of why the symptoms actually exist. So that's one
Yeah.
of the main reasons why insurance companies don't cover what we do.
And I'm not here to bash doctors or pharmacies. I just know there's more. There's way more. And what you said was key. Being, what did you say about being a body detective? We're all different.
That's right.
I had a continuous glucose monitor on for a couple of weeks. And what raises your blood sugar doesn't, my blood sugar goes off the chain with just a Triscuit or, a cracker of some kind. Well, that might not do that to you. We're all so different. Our hormones, everything is different. And I think I read an average 7 minutes is what a doctor has on his schedule
Yeah, that's right.
anymore. And it's like cookie cutter, and we're not cookie cutters. We're not like Chevrolets. We're we're all different.
Well,
And so,
remember, that's how they get paid. They don't get
yeah,
paid by spending time at 30 minutes to an hour with every patient trying to figure out every symptomatology and why the symptomatology exists. Again, there's a pill for every ill and an ill for every pill. And so it's really about disease management and treating that symptom because in our reality, and again, this is not a knock on doctors and nurses, and it's not about shame or condemnation. It's just the way it's built and it's the system that they're under. It pays to treat, not to cure. And so when you have a system that's paying to treat you, they don't, again, it's not necessarily in their best interest to always try to sit and find the core root of why the symptoms exist because they're going to lose a customer. They're going to lose a client at that point. But there's also something else that most people don't even consider, Lynn, and that is there is a big research gap, at least in their eyes. There's this gigantic gap that insurance companies look for very specific types of what we call evidence-based outcomes or evidence itself. And so what they do is they have these large clinical trials that are mostly funded and paid for by the pharmaceutical companies. And then they create from those trials what with a predicted outcome, if you will, based on the medication that they're trying to study. And then they come up with standard dosing. And then they had the same treatments across many, many different thousands of people, hundreds of thousands, if not millions of people. And just like what you said, that standardized treatment for Lynn Eldridge does not maybe necessarily mean that should be the standardized treatment for Scott Oatsvall because we definitely are going to respond to certain things differently. So when you get into the holistic side of healthcare, our therapies are always individualized. They're always used in combination with other adjunct therapies and natural treatments. And the beautiful thing about what we do, Lynn, as naturopathic practitioners, is that we actually can adjust when we need to. We don't have to wait for clinical trials. We don't have to wait for the next medication. We don't have to wait for a doctor's approval to say we need to change gears because this is working, but this is not. And so we
right.
can adjust it over a period of time. And so even if there's strong support, it doesn't always check the boxes for the insurance companies, even though we have better evidence-based outcomes than they do.
Right. And there's not always a pill to solve a problem where you don't get any protein or carbohydrates that are complex, not Cheetos, or that's not even food. But when I know for myself and some others, I can tell what I've eaten the day before, my mood today or my stomach today will tell me. And um I was in a relationship married to a doctor for a while, and the point was we never he never got any nutrition training. I went all the way through medical school with him, and maybe he had 2 hours, but the truth is, garbage in, garbage out. Is that fair to say? Some of that's truth too.
Absolutely. And, there's a famous saying that said, food is thy medicine. And really,
Right.
God created the herbs and the fruits and the vegetables and the meat and the animals. He created everything that everything our body needs is in the earth. So again, when you think about that, well, but one of the things you just reminded me of something. One of the things you said you were married to a doctor. When they're trained in medical school, like you said, they may have the option to take a 2 hour elective on clinical nutrition, but that's about it. And so they
And
will,
it's an elective.
it is an elective. And interestingly enough, that's not required. And the other part of that is think about they are having to spend so much time in pharmacology that really that dominates the last half of their medical training before they go into their residency. And so when you think about the two different care models, if you will, the traditional medicine is basically a fee for service and then prescriptions on top of that for the insurance companies to pay out. So in essence, you pay for each visit, each test, each procedure, and each prescription. Where holistic care and naturopathic care is more of a programmed approach. So, in other words, you're going to have longer visits, you're going to have ongoing adjustments for your individual treatments, and there's going to be multiple therapies and technologies that are actually working together. And when you think about it, that really doesn't fit neatly into the insurance billing system. So, they really don't have a way to bill for that. And that's why doctors don't have time to spend time with you answering questions and really getting to know you anymore because they have to get on to the next case.
Right. And if they cure you, if there's a cure, Big Pharma just lost a customer, didn't they?
Yes, and by the way, pharma has been in business. One big company that we all know about has been in business over 125 years and never had a cure for anything, but yet they've got multiple disease management medications that's just billions of dollars a year.
Right, right. I noticed, that I was on psychotropic drugs for 20 years and, knew quite a few people in the addiction and mental health community. And I never did meet anybody that got cured.
Yeah. Well, it's the biggest gap that we have in healthcare today, which is really not healthcare, it's sick care, is prevention versus treatment.
Right,
When you think about prevention versus treatment, it's two completely different philosophical views and approaches. Insurance is mostly designed for number one, they're diagnosing some type of disease or disease process. Number two, they're dealing with acute problems. And number three, they have all these necessary procedures and testing and things that they have to do before they can even make a recommendation for you. So that it would be treatment. And then when you think about prevention on the holistic side, holistic care focuses on a lot of the prevention before it gets to that point,
right.
strengthening the body, creating an internal balance, making sure that the body's balanced in terms of the cellular level. And so those things are often labeled optional or supportive, if you will, so they really don't get covered by insurance.
Well, no, no, they wouldn't be covered by insurance because if we were well balanced in our diets and our emotion and in our forgiveness and if things like that, then I think there's scripture that said none of the diseases that I put on the Egyptians will come on you, if you're faithful. And I'm not saying that there's not pollution on this planet. We live in a fallen world, you know, there is pollution and it is toxic. And there's a lot of toxic emotions going on even in our country right now. And part of it is pollution, part of it's stepping away from God and living in unforgiveness instead accusation, and that will make you sick. We can eat as healthy as we want and run marathons and die of bitterness. So, but I love the return to healthcare. Somebody I care about deeply was in the hospital last year, and I went to the doctor and I said, "This is neither health nor care. He's not getting what he needs." This is a train wreck.
Yeah.
Um, so it was very disturbing. What I realized is a lot of I'm not anti-drug. I'm anti-chemical dependency. Does
Yeah.
that make sense?
It's kind of like saying, a lot of people when I was, speaking out against COVID and the new mRNA technology and the gene therapy shot that people were being forced to take and coerced to take, they really labeled me as an anti-vaxxer, and that's not true. I'm not an anti-vaxxer. I'm an ex-vaxxer because
Yeah.
I used to believe in that vaccine system, and I used to believe in what it was doing for public health care. But now when you have more information, my grandmother used to always say, when you know better, you do better. And so
Right.
when the science doesn't line up with the actual results, and when everything is hidden and suppressed, and when you know somebody's lying to you, when you find out somebody has lied to you, it automatically should create a suspicious mind, and you ought to be able. I think it was Ronald Reagan that said, trust but verify. The Bible
Right.
says it a little bit differently. The Bible says, out of the mouth of two or more witnesses, a thing can be established as a truth. And he that answers a matter before he hears it is a shame and a folly unto himself. So, one of my mentors, Dr. Chuck Missler, used to always say, he would say, condemnation without investigation is a surefire way to keep you in a state of ignorance. And boy, that's
Right.
a good statement right there. And it's saved me so many times. Condemnation without investigation will always leave you in a state of ignorance. But one of the reasons, Lynn, that we don't have the type of choices that we think we have, think about this. Your whole life you pay big premiums to have health care coverage and insurance. Then when you go to the doctor, you got to pay a deductible and you got to pay a copay. And then you have to pay a treatment process that the insurance doesn't cover 100% or whatever they don't cover 100%. So and then sometimes your insurance will even deny that coverage. And then you'll have to
Yes.
be putting out of pocket that whole expense. So the economics behind, I call it the economic driver. The economic driver behind insurance companies are managing, you got to think about this. They're managing the cost and disease across millions of people. So, what are they most likely to pay for? They're most likely to pay for things like predictable treatments. They're most likely to pay for things like standard pricing that they have negotiated through the hospital system or through the insurance companies. And then they're actually more likely to actually pay for like what we call short-term results, or at very best, a temporary fix. But the long-term care focus, the long-term customizable care, the less predictable, if you will, there's a cost structure to the holistic care model. It's very, very different than the insurance care model because, again, they want to look at what they can manage and pay the least amount of for the most amount of money that they bring in. So again, it doesn't fit their financial model. And so again, that's why you don't see many holistic practitioners and holistic providers even have an option for insurance because they just don't pay for it.
Right. And I had one of those experiences where I had some surgery and then um the insurance company said, well, we didn't feel that was necessary. So I got to pay for it out of pocket,
Yeah.
which was a real shocker and a hard hit, even financially. One of the things that um, I caught COVID about a year ago. I went to an international gathering and a bunch of people, for some reason, got sick. And I started feeling chest pains. I went to the ER because I was going to err on the side of caution. And before they even pricked my finger, they had two meds they wanted to put me on for life.
Yeah, for sure.
And I'm like, but you don't even have my address yet.
Right.
But they wanted to put me on them for life.
Well,
And
they want,
and it used to be it used to be the kind that would go okay, but not anymore. And
yeah,
she kept pushing. The doctor did, and I said, "Look, this is not going to happen. You haven't even done a blood test."
right.
Well, it's our protocol. Well, I've got a protocol too. I don't want to be on drugs for life. You haven't even examined me. So we've gotten away from healthcare.
Yeah, it's not healthcare anymore. It's sick care for the most part. And that's why it becomes a self-pay scenario. because of when you think about holistic care, it's usually you're going to have to pay out of pocket. But here's the good news. What are you actually paying for? That's the question. What are you paying for when you go to a holistic practitioner or provider or a naturopathic provider or practitioner? You're actually paying for customizable flexibility and truly personalized care. So when you combine all of those benefits with the multiple approaches, and by the way, without restrictions, that's the main thing, is that nobody ties my hand when I'm trying to help somebody get to the core root of why they're struggling with their health challenges. But the core difference is when you get it down and you really pull away the layers, the core difference really, Lynn, is philosophy. So at the end of the day, it's really two different mindsets. There's an insurance-based care, which is basically standardized. It's all protocol driven. It's basically very, very uncustomizable care about managing your disease, which is sick care. And then you have the other side, which is holistic and naturopathic care, which is very individualized. And it's especially in our practice in our clinic, it's whole person focused. So we don't just look at the physical, we look at the mental, the emotional, the spiritual. It's all our mission statement is that we educate our patients how to get healthy at the cellular level while we nurture you, the whole person, mind, body, and spirit. So that's really the main differences.
Yeah, I think that our society's forgotten that we're body, mind, soul and spirit,
Yeah.
and toxic emotions will pour toxins into your body, right? I mean, it's toxic food, toxic environments. I'm more careful who I, you know, run with all the time because it's catching,
Well,
right?
you gotta be careful. You got to be careful who you invest and spend your time with. My grandfather used to have a story he would tell us. He said, when you go to the barn to milk cows, when you leave, the cows don't smell like you.
Yeah, right. Right, right. And
So
you
we have to
said,
be careful.
what is it that Chuck Missler said that you were talking about?
He,
Investigate.
yeah, he said condemnation without investigation is a surefire way to keep you in a state of ignorance.
Well, I was
Condemnation without investigation.
right. I was told that with, as a I knew everything when I was a drunk, and I was told to put down prejudice against words and not have contempt prior to investigation. And I think that contempt prior to investigation, I was just, trying to get something for my dog for fleas the other day. And I think the package was ivermectin. And when I was calling the big company for, for, um, to order the prescription, he goes, okay, what veterinarian clinic? What's the name of the clinic? And I said, well, it's a holistic thing. He goes, holistic? And I'm like, yes, she has a license to practice. This prescription is good, but I'm trying to get flea medicine. His reaction was a little bit like I didn't quite understand that. I said, sir, I'm not trying to buy something illegal here. It's something you sell, whether it comes from a holistic doctor or not. Does that make sense? There's contempt there. So what
Well,
my
there's
point is.
there's also some level of arrogance that, and it really I've got a lot of friends in the medical and scientific community, and several of them are medical doctors. And I remember years ago, we had two of my real close friends. One of them was a very prominent surgeon here in town. You would probably know him. And then the other one was an anesthesiologist across town at another hospital. And they both showed up at my office one day. They were on my schedule. I saw they were on my schedule. And I said, what are you guys? So they sat in front of me. I said, what are you guys doing here? And they said, well, we want to know exactly what you're doing. And I was like,
Yeah.
you guys know what I do. Why do you care? Well, what are you doing here, really? And they said, well, we don't really believe in all of the stuff that you talk about, the frequencies and the frequency healing and the therapies that but you get better results than we do. And so we want to know what this is all about. And so sometimes it's just a matter of education and a matter of exposure, because again, they're trained a very, very specific way, and they're also trained never, never, never go outside these guidelines, because you don't want to lose your qualified immunity as well as your. That's why their malpractice insurance is so high, is because the third leading cause of death in this country is medical malpractice and medical error. Most people don't even know that. And I'll give you a great example of this. When I talk about, we have a lot of patients that come to us with cancer, a lot of patients. And I never set out to be the cancer guy. I never set out to be the Parkinson's guy. I just wanted to be a holistic health coach and holistic provider that helped people reverse chronic illness and disease and stay off medications and stay out of the hospitals. But we've become known in some arenas as the people really to go see if you've got a serious life-threatening situation. And so we always talk about the immune system, because in cancer care, this is one of the most important and honestly most understood pieces of the puzzle for cancer. And so you hear a lot about immunotherapy. It's becoming a major advancement in conventional oncology, and for good reason, by the way. But at the same time, there's another conversation that's happening, one that's centered around this holistic approach and immune support and getting the voltage in the body back up and making sure that the cells are aligning and getting charged back up. And while both involve the immune system, they're actually very different in how they work. So what they're trying to accomplish and what we're trying to accomplish has different impacts on the body. So that would be one of the things I would tell you when I have people in the medical community. The doctors are coming to me and saying, "How are you doing this? Why are you so much more successful, at least from a statistical standpoint, than what we are?" And again, this just doesn't make sense. And so it's puzzling to them. And I know that a lot of people looking from the outside in really look down on naturopathic healthcare, naturopathic medicine, homeopathics, holistic healthcare. And again, things are changing. The tide is turning. And Lynn, I think 2020 really helped our industry out a lot, because I truly believe I don't think that the healthcare system will ever be trusted again until somebody is held accountable for what they did to us in 2020.
Right, right. And this breaking news with Fauci, it's breaking some people, you know, but
And it's waking up a lot of people. But unfortunately, we see so many people that are injured due to these medical treatments. We see pericarditis and myocarditis and cardiac toxicity and pulmonary embolisms and neurological disorders and turbo cancers. We're seeing them at a rate that I've never seen them before in my whole lifetime. I'm 33 years into health sciences. I've never seen this type of reaction to a medical procedure in my lifetime.
right, right. I get it. I have friends that are really hurt. But anyway,
But here's the good news. There is actual hope for this. Most
yes,
people
I've
are
heard
being injured by what's called a spike protein uh,
right.
raising up in their body, the spike protein. We actually have developed a protocol that we've worked with people across the country on, very, very prominent cardiologists and food scientists and a lot of doctors and really great formulators. And there's a product that we have called Virus Spike Clear on our website. So if you know of anybody that's been injured by any medical procedures like the shot that they took, then this is something that can really help lower that spike protein in their body.
Okay, and we'll put a link to the website in the show notes.
Okay.
And you might thank you for sharing that. So meanwhile, you know, I understand there's a lot of injuries going on. I understand there's a lot of illness going on. I understand that the rates of America of heart disease, cancer, diabetes, Parkinson's, you name it, has just gone up over the decades. And it's even flown more since COVID, right? And so bottom line is it ain't working well. I mean, it's definitely time for a change of thinking. And so I've been doing a deep dive into nutritional deficiencies, which my goodness, there is no nutrition in our bagged or boxed food. In fact, it's not even really food according to the Bible. And so we're suffering as a society. I learned during the Great Depression there was an epidemic of schizophrenia, and they were throwing people into insane asylums. And at least one of those that I know of during the Great Depression was my great uncle. And I think there's that Dr. Abram Hoffer went into the insane asylums and started giving the patients vitamin B3, according to what I've read. And they said 83% of the schizophrenics got healed. And so we don't have a, a, a famine going on. After the Great Depression, then there was 10 years of Dust Bowl. But we have a nutritional deficiency, a nutritional famine going on because there's no nutrition in the gas station food and the ultra processed food that so many people consume today, including like 60 some odd percent of teenagers. Their diet's processed food. And there's not a lot of vitamins in there. And we were including copper or essential minerals, including all these things that we were designed to function with. We were talking about copper a little bit earlier and frequencies.
Well, one of the things that, when you go into the traditional healthcare system, they're just not going to ask you a lot of questions like this. But if you come to our office, for instance, and we go through an evaluation process, we have a bioenergetic frequency scan that scans 800 panels in your body. And one of the things, like we have a list of things that we go down, like how is your body being nourished? What's happening with your gut and your gut microbiome? What's the level of inflammation in your body? How's the body handling stress and anxiety? And are your detoxification pathways open and are they functioning at the cellular level? What does your non-specific tissue injury and or inflammatory process look like? So again, we have a much, much bigger advantage than the healthcare community because I'm seeing your whole body right in front of me. And I can see exactly where your body is deficient. I can see what systems are compromised. I can see where your nutrient deficiencies are. I can see what targeted nutrient therapy that I would go after or recommend for you. I can actually see what your GI looks like, what your gut and microbiome restoration might look like once we get on track, the detoxification strategies and the vagus nerve stimulation. All of this is tremendously important and vitally important to figuring out what your actual needs are and where you're deficient. So think about just looking at just blood work, which again, we used to do a lot of blood work in our clinic. We don't do that anymore. We don't have to. We can go a lot deeper than blood work. But think about taking a snapshot of about 35 different panels on a fasting state, which that's what they require you to do, is fast, and then you go have a blood draw. They look at about, that's a good panel if you look at 35. Some of them are less than that. And then you compare that 35 panels to 800 panels. You can see it's not even close. It's not even, and by the way, you can have a fasting blood panel and show one numbers and show whatever your panels read. And then an hour later, go eat lunch or go eat dinner and come back and do the blood panel again. It'll be completely different. So again, these are key differences, and these when you look at holistic versus traditional, these are the things that you really have to consider where the value lies. And so you're right. We've got to be waking up. We've got to be taking greater responsibility for our lives and for our health. Because guess what? The Calvary, we saw this in 2020. The Calvary is not coming for us.
You're right. Yeah, and I love that. I am responsible for my health. You know, it is a personal responsibility. I don't know how to emphasize that anymore. I can't just keep eating gas station food and wonder why you can't help me. Does that make sense? And was that scan you were talking about the one I took with you?
Uh, Did you take the full body frequency scan?
I did one in your office there.
Yeah. Yeah, that would
Yeah.
be the full body frequency scan.
Okay. Yeah, yeah. Well, that was cool. That was informative. That
Yeah.
was brilliant. It was fun.
And really, again, that technology has been around a long time. Most people aren't aware of it, and other people would, like the medical community, would frown on it. Like my two doctor friends who came in and saw me the other day, or this was actually a few years ago, but they said, we just don't know about all this frequency stuff. And so I asked them the question. I said, well, have you ever recommended an EKG for any of your patients? Both of them, yes, of course. What
Yeah,
about a CAT scan? Yes, of course. What about an MRI? Yes, of course. Though that's all frequency. That's
right.
all frequency testing. That's exactly the same technology we have in our software and our equipment as they have in the major hospital systems. And so again, it's the same theory and the same technologies that have been used for a very long time to look at the cellular level.
Well, it's time to do something different, If if it ain't working, then it's time to do something different. And at the end of the day, that's what brought me down the path to like where I met you and everything, because what I was doing for 20 years, it just didn't work. When I came to the end of myself, and I'm like, there's got to be a better way, you
Yep.
know? So,
And if you don't put those, at least start with those foundational principles. If you don't put them into place, what you eat, how you sleep, what are your stress levels, what does your microbiome look like, what's the environment that you're creating around you, what are you thinking about, what are you taking captive, what are your thoughts, is there stress and anxiety? If you don't put those foundations in place, it really doesn't matter what you do because you're headed for a one-way street, really, and your body's going to be under tremendous amounts of strain and pressure. And so it's not just about targeting the disease, but it's about supporting the whole body as a whole, mind, body, and spirit. And so when you do that, again, you're trying to elevate everything that God has already put inside of you so that you can be everything that He's created you to be. Because think about how many people, Lynn, are walking through every day and they're just limping to the finish line every day, barely surviving, trying to get through. They're waking up the next day. They're not sleeping well. They're waking up tired and they're trying to repeat it again. And I mean, it's hard to be everything God's created you to be when you're tired all the time. It's
right,
hard
and
to
then,
be. Go ahead.
sorry, I'm sorry. What gets me is this is 30-year-olds, 25-year-olds too. It's no longer the elderly or aged.
That's
It's
right.
unbelievable.
That's
That just concerns me so much. And what I think I hear you saying is we don't want to just survive. We want to thrive.
that's exactly right.
There's a huge difference there, right?
No question about that. No question about that. And that's why we've got to take greater ownership of our health and great ownership of our temple. Because we can explore all of these foundational principles. We can explore all the technologies. We can look at, everything that we need to do in theory that will help us. But there's one truth that always remains at the foundation of everything. God is the creator of heaven and earth, and He is the creator of your body. And God has created your body to heal and repair itself. He's designed it that way. And the power that's created you is the power that's within you. And you've got to understand that it don't matter what mystery you're facing as it relates to your health. It doesn't even matter what you don't understand. There have been civilizations that have risen and fallen, and there's knowledge of all kinds of great truths. But if you don't understand that the greatest truth is found in a person by the name of Jesus Christ. The greatest truth is that Jesus said, I am the way, the truth, and the life. The greatest truth is that God has created your body to heal and repair as long as you create the environment that He gave us to make sure we could stay healthy. So I would encourage all of your listening audience, keep searching, keep asking questions, keep exploring. There's answers out there for you. If you're dealing with a health crisis, if you're dealing with a setback, a loss, a disappointment, a betrayal, it does not matter. Mentally, physically, and spiritually, there is an answer for you, and God has that answer for you. Now just put the pieces together, keep asking questions, and remember that God is the creator, Jesus is the way, Jesus is the truth, and Jesus is the life. And He's created life in you so that you can fulfill your assignment in the earth.
Right. Thank you. Thank you. Thank you. Yeah. When the doctors told me there was no way, Jesus said, I am the way.
I am the
So
way.
if you seek me, you will find me. If you seek me
Yep.
with all your heart.
Well,
And
if I
boy,
could throw out my email for everybody, if you don't mind, if anybody, any of your listening audience has a question personally, you can always email me, Dr. Scott, DrScott at L as in life, T as in transformation, the number 360, Dr. Scott at LT360.com. You can always go to our website, LT360.com, and find out more information as well.
amen. Well, thank you so much. We'll put that in the show notes as well. Thank you for coming on, especially last minute. This has been great as usual. And I hope we can do this again. And
Just
you
reach
have
out to me and let me know. I'll be glad to come back. It's a privilege and a pleasure for me to be with you, Lynn. Bless you
my
and
honor.
the listening audience, okay?
Yes, sir. Thank
All right.
you.
Take care
So
now.
for more info, stay tuned. You'll find all the resources in the show notes, how to reach Dr. Scott, and be blessed.
Share it, rate it, review it. That's how we crack the system and spread real healing. Want to stay in the fight? Follow me on social media at Lynn Eldridge Official. And if you believe in what we're doing and want to support us, just grab the link below or send this episode to someone who needs the truth. Remember, don't just heal. Heal loudly. Heal boldly. Be dangerous.